Welcome back to the HealthTech Edge. I'm Mike Moore. Today, we're talking about something that sounds simple on paper, but it quietly controls a lot of outcomes and a lot of dollars in healthcare: care management. Medicare has paid for transitional care management and chronic care management for years. The evidence is pretty clear. When these services actually get delivered, hospital readmissions go down, complications go down, and total spending drops. And yet, most patients who qualify never get enrolled. Most practices either don't know or have the staff that can keep up with the billing rules, the follow up workflows, and all the associated steps. The result is missed care and missed revenue, especially in smaller and independent practices. My guest today is trying to fix that with automation, but without taking decision making away from clinicians. I'm joined by Dr. Darin Patmon. He is a plastic and reconstructive surgery resident and the founder and CEO of Elite Care Technologies, a clinician led platform that uses AI to automate transitional and chronic care management, reduce administrative burden, and improve outcomes in underserved communities. We're going to talk about the problem he saw on the front lines, how Elite Care actually works, and what they do and do not automate, and what it would look like if care management adoption finally caught up with the evidence. Darin, welcome to the show.
Thank you for having me, and I really appreciate the introduction.
Yeah, excellent. So just let's start with a little bit of background. Can you just introduce us to kind of what you are doing today clinically and kind of the role that you're in?
Yeah, so myself, I graduated about 2.5 years ago from Michigan State University from their MD MBA program. And then following graduation, I got accepted into a plastic and reconstructive surgery residency program. And so that is currently my one of my two full-time jobs. That is my full-time clinical job.
Yeah, I think the at least what we see, on television and in film, shows that the life of a resident is not a simple one. You're burning the candle at both ends and trying to make things happen. And because that wasn't enough, you've also founded a tech company. So, what led to the start of Elite Care Tech and what you and the team are doing there?
Yeah, so overall, the how they portray resident life in terms of just like the time commitment is pretty accurate, spot on. So with all the free time that I have, I decided to start Elite Care Technologies. And what really prompted that was during my educational years at Michigan State University, doing my MD MBA, I was also helping manage a medical practice. And during that time, we were a small medical practice, and I was realizing that a lot of our patients would go to the hospital, be subsequently discharged, and then we wouldn't hear about it for days or sometimes even weeks after the event occurred. And so not only did we not know where our patients were and what their healthcare status was, we were unable to provide them with timely follow-up care. And so that resulted in a decent number of our patients being constantly bouncing back to the hospital and experiencing complications that would be relatively avoidable if we could provide them with really timely and close management after a hospitalization.
So you've got this, important piece that's missing at the practice that you're managing, but then you take the leap to say, this is a problem that, kind of if this practice is experiencing this, chances are others are experiencing it as well. So when you began to look into the issue or kind of the magnitude of the problem, what did you find and what solutions were out there in the market?
Yeah, so I discovered this problem within our own practice, I went out and tried to find a software solution that would kind of help us manage this because a lot of the services and the tasks that are required for these care management services are very time sensitive in order to bill for it. So I went out to the market, found a couple solutions, but again, nothing that really fit the need of our practice, which was relatively small, just over 1,000 patients. And when diving into the market even further, I realized that this wasn't only just a problem for our practice, this was a national problem with less than 20% of all eligible patients actually receiving care management services, specifically transitional care and chronic care management services. And so based off of that market research, I decided to step out and create a solution for it, and that was kind of the birth of Elite Care Technologies.
That's great. And when you when you look at this, there's kind of the anecdotal sense like we don't know where our patients are. We hear stories, oh, and now they're back in the hospital by the time we find out. Have you looked at research? Is there some data that's out there in the market, either from the government or other organizations that help you size this issue in the United States healthcare system?
Yeah, so we look at Medicare numbers because Medicare is kind of like the obviously the big governing body that pushes a lot of the regulations when it comes to healthcare reimbursement and healthcare services. And so, of all the eligible Medicare patients, anywhere from about 15 to 18% of Medicare eligible patients who are discharged from the hospital receive that timely follow up care as outlined within Medicare's transitional care management program. The adoption for chronic care management is even worse. That is anywhere from about 10 to 15% of all eligible patients receiving those services. And this is costing the healthcare system within the United States billions of dollars annually on avoidable readmissions to the hospital and avoidable complications. So it's quite a large problem that the government's trying to, fix through incentive programs. Again, in order to bill for these services, there's a lot of tasks, a lot of manual labor that goes into it. And the majority of the market, specifically the smaller to mid-sized practices, just can't afford to do so.
So enter Elite Care Tech. So you and the team put together a solution. So walk us through how it works. If a practice signs on board, enrolls, and kind of uses your product, what happens, and kind of what are the steps that end up taking place?
Yeah, so once we partner with a practice, we will all we need from them is just their patient panel and some basic demographics. We then register both the practice and their patients on this national network. And through this national network, we're able to basically track patients in near real time as they're transitioning through different healthcare facilities. And we have then built the back end of our platform to automatically screen patients for care management eligibility based off of their healthcare records and their discharge status. And so as we're tracking all of this data in near real time, we'll automatically screen them for eligibility. Once they're eligible for a service, we'll ping the practice, their medical provider. And then if that patient is enrolled, we then kind of provide full suite end to end automation for the tasks that are required to bill for these services.
So you're really using the software piece of it to support the human clinicians, right? There's no automation that takes anything out of the hands of clinicians, is what I just heard. You're simply facilitating, like helping them notice what's happening with their patients and when there's an event and when there's eligibility. And then if they choose to trigger the next part of that, then you can help with the automation of kind of connecting the next set of steps. Is that a fair assessment?
Correct. And so the literature is pretty clear that one of the biggest factors of burnout for healthcare providers is the administrative burden and all of the paperwork that goes into healthcare. So ever since the adoption of EHRs, healthcare records, there's a lot of administration and a lot of manual labor that goes into providing services. And so we basically try to take all of that out of chronic care, transitional care, and just care management services in general. All the clinical decision making is always still in the hands of the healthcare providers. We just automate all of the busy work.
So let's put this in kind of a real world scenario. So if a patient is in the hospital, I don't know, you can probably come up with a scenario better than I could, but they're in because they have chronic kidney disease, they've had some sort of a flare up, they're trying to get, whatever their levels under control. They're discharged. What would the services look like, or kind of how does this actually land in practice? Like, what's the experience from a human point of view?
So our platform takes a very individualistic approach to care management services. And so we're able to really tailor our recommendations based off of the patient's healthcare records. So let's take your scenario, for example. Patient goes in, they have end stage renal disease, and they're hospitalized because let's just say their AV fistula went down and they have to go to surgery, create a new fistula so they can continue with dialysis. They may they may be in the hospital for several weeks or several days. Once they're discharged from the hospital, we get that notification and we tell their primary care provider, hey, this patient, John Doe, was just admitted to the hospital for this reason. This is how long they were in the hospital for. These are the recommendations for follow up afterwards. And so we tell them you should contact this patient within 48 hours to go over their healthcare record from that inpatient stay with them. After that, we provide an automatic medication reconciliation. So if the patient was prescribed a bunch of new medications, we're able to provide that to the primary care provider. So now instead of the primary care provider focusing 10, 15 minutes of the patient visit on the new medications that were prescribed, we can even take it one step further and say these were the medications that the patient was prescribed, and these were the medications that the patient actually picked up from the pharmacy. So if there's a discrepancy there, your primary care provider can now spend the majority of your visit asking why you didn't take those medications. Did you have a bad reaction last time? Is it because you can't afford it? Right. So now the focus is back on the patient and not necessarily the administrative tasks that are leading up to that visit. And then again, if they're still having, uncontrolled hypertension as a result of their end stage renal disease, we can track their blood pressure and then recommend that maybe we enroll that patient also in remote patient monitoring to ensure that their blood pressure is well controlled afterwards.
That's great. So you're really coordinating a lot of the steps. It's not like just that one transition piece. There is some follow through that connects a lot of the dots and what happens from a discharge event and the associated pieces afterwards. So a lot of folks listening will probably be thinking about integration. So um, is this a solution that lives within the EHR? Is it a separate portal? How, you talked about kind of the national network and following patients, those kind of things. So let's talk about the tech elements a little bit. How does that integration play out and what about the EHR connection?
When it comes to all of the data that we're able to scrape and build our workflows off of, that does not require an integration with the EHR. And so we're able to basically connect with multiple health information exchange vendors on both the national and state level. By doing that, we're able to compile this very kind of extensive longitudinal healthcare journey for each patient. And then in terms of our current workflows that our end users interact with, that is all currently done through Elite Care. We're currently in the middle of a financing round. And once we close that round, that is when we'll really start focusing on some additional integrations to where our end users will never have to leave their, you know, main EHR and you can perform all the workflows directly in the system that you're currently using. But as of right now, all the workflows are performed through Elite Care.
Yeah, that's great. So it gives you the ability to tap into that information, but I'm betting where the integration it's not as developed as some might think, and some may want that at some point. But I'm betting that it leads to faster go live time frame from a customer point of view because you don't have to do all that level of integration, but you're still benefiting from the national networks and kind of the information on the patients is most important, I think, and probably getting up and running quickly. Is that a fair assessment?
That is, and our current kind of go live timeframe is about 1 week from whenever we get the patient panel from our end client. So because we have so much automation within the back end of our platform, um, our users spend very little time actually performing tasks within Elite Care. And so it usually takes us about 24 to 48 hours to actually upload the patient panel and ensure that all of the data is coming through appropriately. And then once we have that, it's usually only about 1 or 2 training sessions on Elite Care and the actual workflows within the system. And then our clients are usually live within about a week.
That's great. And so from an early customer point of view, what are some of the results that you're seeing? What's the impact like for a practice?
So, for example, we just recently onboarded a client just last week, and we did an ROI analysis on them based off of historical trends. And for all the medical practices within this group, we were able to realize about $200,000 of unbilled revenue for care management services. And then, based off of the current literature out there, by implementing care management services for these patients, they will expect about a 20% decrease in rehospitalizations after discharge. And so, in terms of some of our current clients, one of our clients experienced a 30% decrease in readmission rates from 2024 into 2025, which was honestly better than we anticipated. And so the results are quite promising early on.
Yeah, I think it's some things that are quirky about healthcare, right? Is that we spend some money now on the transition care and chronic care management steps, but that will, if all goes well, head off future readmissions, which we know is incredibly expensive, and many of those readmissions start with could be a stop in the emergency department where they have to wait for a bed, right? And then kind of all the expensive cost of having someone enter the hospital through the emergency department, maybe spend several days or a week there before they get a bed in the hospital, and then the expensive stay in the hospital before potentially transitioning out to a rehab or something like that before eventually going back home. So spending money up front, smaller amount, heading off the longer hospital visit, shortage of resources in many cases, as well as the cost associated with all of that, and ultimately, hopefully, leading to better long term health outcomes for that patient. Is that a fair assessment of kind of all of this?
Exactly, that's spot on. For example, transitional care management is one of the highest reimbursed outpatient services that a medical provider, specifically a primary care provider, can bill for. On average, the highest code reimburse about $275 to $300 per visit. Medicare and insurance companies are willing to put that investment up front, reimburse you for that in order to save $15,000 on average per hospitalization. And so that's kind of like the monetary value that we're looking at is, insurance companies and our US healthcare system overall is turning more towards a preventative and a quality based reimbursement model as opposed to kind of fee for service. And so kind of like you said, put the money up front, invest up front in preventative care to save large chunks down the road. I think the most recent economic analysis that I looked at, Medicare predicts that about $30 billion can be saved annually in preventable readmissions through care management services. And care, specifically chronic care and transitional care management is underbilled by about $1 billion annually. So invest $1 billion to save 29 billion. I think that's a good bet.
Yeah, that's amazing. And I think that, the numbers that you have around this really paint that picture of what the impact can be. And even like the example you gave of a practice that enrolled a week ago as we record this, right? And, they're going to see those benefits continue, but being able to capture that revenue, but then also, again, better coordinate services for this population that they're trying to serve in their practice is, I'm sure it leads to better outcomes. So, as a practicing doctor, there's a concern that's out there in the market, especially as, this year, just new AI innovation comes out almost daily, a new updated model or a new company or a new this, and everything's just kind of happening quickly. What do you say to your colleagues who are concerned about AI overreach and the role that this technology is playing? And does it make it so that doctors eventually become obsolete, or what do you think? And kind of what's your take, both as a doctor and as a tech entrepreneur?
That's a great question, and I'll shout out our COO right now. His name is David Reed. He is probably one of the most. He's also a physician. He was my roommate in undergrad or in medical school, and he's a huge skeptic, right? And so, it's good to have someone like myself who's like a pioneer, sitting alongside someone who's a huge skeptic because we kind of have that happy, balance between the two of us. But in terms of what I'm seeing in practice is one, tech companies will never take on the liability of medical decision making, right? So with the human component of it, like myself as a practicing physician, there's a lot of liability that comes with our job. And so if we're telling technology to now come up with the medical decision making that a clinician does, there's going to be a lot of liability that comes with that. And tech companies, in my opinion, just will never take on that liability. Second of all, a lot of the technology and the AI that we're seeing in practice is again coming through augmentation as opposed to clinical decision making. So I am now able to focus a lot more of my time on the actual patient in front of me, as opposed to ensuring that I have all the proper documentation and all of the notes to ensure that I'm billing according to Medicare and other insurance, guidelines. And then the final thing that I'll say is that um, I think that for the implementation of AI, for the most part, again, I think there might be this misconception of what AI can do. Specifically, how we're implementing AI, it has no decision making capacity. All it is we're feeding it kind of like a decision tree algorithm, and it is making these decisions based off of already established norms. And so there's no kind of free thinking of our AI. It's all through just the automation of the tasks that are already well established within the industry.
Yeah, I think that is great, and it's what I've learned from you about this solution specifically is that it's helping to notice the things that are hard to notice in a fast-moving medical practice, right? Is that having been through a bit of this with my own family and caring for loved ones, you know, if they're kind of with it enough to be able to notify their primary, hey, I'm in the hospital, I was just admitted today, here is what they're saying, relaying that information, or the family does that on behalf of the patient, that's one thing. A lot of families, a lot of patients don't have that kind of quick response time and kind of notifying, and then it's kind of like, okay, well, what do we do with that information and keeping up with it, and then when you transitioning out of whatever status you're in, there's just a lot to manage. And so we talk a lot in this podcast about helping clinicians and their staff, quite frankly, operate either at the top of their license for the licensed staff, and then also helping the administrative staff work on high value tasks. This is really hard stuff. And I think that everybody who shows up at the medical practice every day, whether they're a licensed clinician or support staff, everyone wants to do the best they can for their patients. Solutions like yours help them do that in a much more effective way by noticing those things that need attention, bringing them to the surface, providing some recommendations, but ultimately empowering them to take the steps that are going to lead to more healthy outcomes for their population.
Yeah, I think you kind of hit it spot on with that. Is that we're the how we intend to use AI is to augment and to pick up on trends that would take otherwise a significant amount of manual labor. And again, unless a medical practice, which in the most basically majority of cases is not happening unless you're part of a very large healthcare system, most practices don't have the IT infrastructure, the financial capital to actually perform this. And so that's where AI comes in, and AI is great. It can scrape a very large uh, volume of data and present it in a very user friendly and streamlined way.
Yeah, that's great. And I think the data validates the why you're in this space, right? The eligibility high, the actual take on it is low, right? So you can see the gap in the data based on the billing codes that are publicly reported as part of the Medicare data that's released nationally. And then being able to measure that same impact that it would have at the practice level about, again, what population is eligible based on the events that are taking place, and now what's the uptake on it based on the implementation of your solution. So the ROI on this, at the local level for a practice as well as kind of an aggregate for all of your customers, I'm sure you're just loving the data and the team's loving the data and kind of what you're seeing for the results coming from this.
Exactly. And I myself am a huge data guy. I do a lot of research in my actual clinical practice as well. I spent a whole year during medical school actually doing research at the Children's Hospital affiliated where I work. And so I also think, just kind of generally speaking, a lot of physicians and clinicians are data driven. And so that's what we try to do, is just empower our users, empower our physicians and providers with that data so they can make more informed decisions. And I think kind of like the proof is in the pudding. We'll just provide you with the data. We don't want to sell elite care. We want to sell better patient care.
Yeah, that's amazing. So, well, and I heard you say that you're working on a funding round. I won't put you on the spot of anything more that you're working on for the future, but this is obviously a fast-moving space. I know you're working hard to deliver for your customers today, and I'm sure expand your footprint and probably have a whole bunch of ideas for the future. So, we'll be excited to follow the trajectory of you and the company and see all the good things that you're doing. So, Darin, thank you so much for joining us today on the podcast.
Thank you so much for having me.
All right, so we'll go ahead and wrap up today. If you enjoyed the episode here, we ask you to like, comment, share with a colleague, especially for those folks who are out there wrestling with care management, burnout. We see a lot of opportunity with the application of artificial intelligence in healthcare. So thanks for listening, and we will see you next time on the Health Tech Edge.